Welcome. This is the Albany Med update on October 30th, 2023. I'm Alan Boulos, Dean of the Albany Medical College. This is my colleague, Dr. Ariel Jadovich, board-certified pulmonary critical care medicine attending. Thank you for joining me, Ariel.
Thank you.
Today we're going to discuss a number of different issues, but we'll start with our traditional approach, which is looking at the viruses that have caused admissions at the hospital over the last year and a half. We've historically looked at COVID-19, and what we're seeing this year is much reduced numbers compared to a year ago. And in fact, the decline in admissions has already begun, which is earlier than it did 1 year ago. We're thankful for that. We also have RSV, and unfortunately, we're starting to see a few cases of RSV admissions over the last couple of weeks. Last year, this resulted in a very significant event where both COVID-19 and RSV affected hospital numbers with significant admissions both in the intensive care unit and in the floors. The good news is this year, RSV has some treatments that we can provide that we couldn't provide last year. There are the development of vaccines which are receiving FDA approval. And at our hospital, we have a monoclonal antibody which we can administer, which will help reduce the incidence of RSV and also reduce the severity of it for those who do get it. We're starting to provide that when we have it available to us in the neonatal intensive care unit, which is where our sickest babies are held, and they have the most protection to gain from that monoclonal antibody. Pretty remarkable.
Yes.
As a pulmonologist, pretty interesting to see the changes so quickly and how we can take care of patients with this.
Exactly. So the time to generate a new vaccine has accelerated dramatically over last years. Now we are recommending following the CDC guidelines, patients with previous medical conditions, comorbidities, we call it diabetes, heart failure, COPD, asthma, to receive the RSV vaccination at 60 years old. Otherwise, people can get vaccinated after 65 years old, but it's a very important tool to attenuate the possibility of developing severe pulmonary conditions in these patients.
Yes, so RSV can really affect the edges of the population very significantly.
That's right.
Related to the COVID vaccinations, I know there's some controversy over the boosters. I guess I was looking at, from a board's perspective, what is the current recommendations for the booster?
It's an interesting question because most of the studies that have evaluated the durability of the protection entailed by COVID vaccination show that the vaccine is useful up to 6 months after the initial administration. So the booster is a very good way to somewhat prolong or extend over time the protection against the disease. Remember that when we didn't have COVID vaccination, people used to come to the hospital very sick, even many people coming to the intensive care unit. We don't see that so often thanks to the vaccines. People still get COVID infection, but they don't get sick enough as to warrant admission to the ICU, certainly, and most of the times not even admission to the hospital. So we do recommend people to get a booster because it maintains the level of immunity necessary to fight the infection, at least the severe forms.
It also might help prevent going on to affecting a more frail citizen who might end up getting more severely ill.
Absolutely. When you are vaccinated, the magnitude of what we call the viral burden, the amount of viral particles that you have in the body is reduced, and then the communicability of the disease is also ameliorated by the vaccination per se.
So a good way to protect your loved ones.
Definitely.
And that comes to our research, and a part of why I've asked you to come here today is the excitement that we see in the college around research. This past month we had our Medical Student Research Day, which was a banner year yet again for us. Over 200 posters were presented, and we had a record number of judges. We were able to coincide the Medical Student Research Day with the Albany Prize recipients arriving and receiving their prize. The Albany Prize is the most prestigious American prize for biomedical and medical research. And those judges included the recipients, and it was quite a special day. I want to give a thank you to Jean Bruno, who's run that for several years, along with Dr. Sidhu, and Adam Gross, who's a fourth-year student who really helped with orchestrating it. I'm wondering, did Do you have related research presented from the students there, or yours mostly graduate student involvement?
Most of my students are graduates already.
And what are they working on?
They are working. We have multiple projects working currently. One is related to long COVID. One of the medical mysteries these days is that we don't really know what this long COVID is from the biological standpoint. There is some research coming up recently, but it's a very opaque disease because patients complain of a very diverse type of symptoms, including fatigue, shortness of breath, mental brain fog, they call. There is no identifiable lab marker that can define which patients have and which patients don't have long COVID. So we are developing a very important research projects in which we are enrolling patients with long COVID to try to identify with sophisticated technologies, including sequencing of DNA from circulating white blood cells, leukocytes, to try to find out if there is a biomarker, a biological blood entity that can facilitate the characterization of long COVID patients.
And what do you think is likely going to be the findings of such work?
We hope to find out that people with long COVID are going to demonstrate a persistent change in the white blood cells DNA that occurs even after full resolution of the acute viral infection. So we've noticed already, and we have published in multiple sources, that even after full resolution of the viral infection, 1 year later, there are some marks, some footprints, we call it, in the DNA of the circulating white blood cells that persist abnormal, even in patients who have no symptoms. So we speculate that the patients with symptoms induced by acute COVID that persist for a long time are going to have even a more robust footprint left by the acute infection.
What is the estimated prevalence among patients who do get infected with COVID that they'll suffer long COVID symptoms?
It's an excellent question, and we don't have an answer for that. The reason we don't have an answer is, A, patients very often do not report having long COVID because they don't understand that this is long COVID, or they don't appreciate that they're gonna receive some kind of treatment that is gonna help them, and some other reasons that lead to underreporting of this problem. The other issue is that the characterization of long COVID is very vague. There are multiple things associated with long COVID, and it's very difficult to say it's something that the patient has. Say, for example, an asthma exacerbation or some kind of joint pain can be attributed to long COVID. So those issues complicate significantly the quantification of patients with long COVID, the disease burden. And that is one of the reasons why we are very excited with the possibility of finding a biomarker that can somewhat substantiate or corroborate the existence of this problem in the patients.
Now, you're a lead investigator on that work, as I understand it.
That's right. So we recently got awarded by the National Institutes of Health a multi-million-dollar grant that is led by Albany Med, and is done in collaboration with researchers from the University of Wisconsin, and is hoping to develop this program until the year 2028. We are very happy because this is going to give us the opportunity to do this research at the scale that hopefully is going to reflect in something that is going to be useful for our patients.
Yeah, you've been remarkable in your ability to collaborate across silos, right?
Yes.
Involving radiology, involving other universities.
Exactly. This is a type, medicine and science as well are the kind of things that cannot be done alone. So you cannot do stuff if you don't work with people and if you don't listen to people and have an attitude of learning from people. And I think that the collaborative aspect of this institution is very instrumental to that goal of building projects and these kind of endeavors together.
One thing that struck me in the Albany Prize recipients presentations, one of the recipients, Professor Bassler, talked about the joy of discovery science when you recognize that moment in time where maybe you have the first person to identify a link or relationship. I have to say, as an academic physician who did research, but it was always innovation where we made subtle steps to improving care, whether it's changing a medication or using a new device. They weren't necessarily leaps of discovery science. It must be exciting in your world. They come less frequently, I suspect, but when they
Right.
come, they're pretty amazing.
Yeah, it's not only less frequently, but also it's very unpredictable. You don't
Yeah.
have any control of the outcome. People say, and I agree with that, that in science, the only thing you control is quality and quantity of your work, but not the outcome. You might work wonderfully and actually end up finding nothing significant, and that is the nature of that activity. I find really exciting the opportunity of discovering new things, and particularly if that is something that could potentially be actionable or helpful for my real world patients. The main, and you know that, the main galvanizing element for a physician is trying to help real world patients who are suffering from conditions and are in a situation of vulnerability. That is a very exciting thing because it's somewhat bridging the innovative side with the humanistic side that is perhaps the most fundamentally galvanizing aspect in us as physicians.
Do you feel like you've had that aha moment where you've made that discovery
Yeah,
moment?
well, one of the single ones that I found out most clearly is when we found out that even after full resolution of the acute infection, in patients who refer being completely normal, they demonstrate lingering abnormalities in the architecture of the DNA that could endure for many years. So that is really fascinating because we tend to think that the disease occurs in a very specific period of time and then goes away, gets resolved, and patient comes back to the normal baseline. But unfortunately, that doesn't seem to be the case. There is some lingering phenomena that occur despite full apparent resolution, and that is the foundation of my vision of what long COVID could end up being.
Yeah, it's fascinating.
Very.
Very much appreciate that effort and that work. It's really, it takes determination and many hours.
Certainly. Thank you very much.
I also want to speak about a few other events that have happened in the college. Most recently, we had community grand rounds. The last one was last week, where we discussed food insecurity and hunger in our region, which is at a rate that's higher than what most would expect, particularly with the recent economy. There's been many who are underemployed, and that's resulted in increasing evidence of food insecurity, which certainly affects our population, our region's health, and their need for care. This was an outstanding presentation by the medical students, Kai Zhu, Ryan Weiss, Thuy Duong Lee, Cynthia Avalos, and then by our commentators, Dr. Jessica Zaman, a bariatric surgeon, Brooke Strauss, who's a social worker that works very closely with the Children's Hospital, Natasha Pernica, who also works very closely with the state on state processes to help with food insecurity, and Jamela Anderson, who looks at some of the underrepresented consequences of food insecurity. All provided really amazing insights to that problem. And you know, one thing I learned in that was that we had developed a food pantry about a year ago as a result of generous donations granting from the Rite Aid. We were able to set up in the Children's Hospital a pediatric family and food cabinet so that they could get supplies. And there are outside sources within the Capital Region, the food pantries for the Capital Region. As they say, just $1 could provide 6.25 pounds of food to a hungry neighbor. So we should do our best to help support our community in such an essential need. It brings me back to some things that the Albany Prize recipients talked about most recently. It was on the microbiome and the risk that malnutrition is likely a result that starts very early on in age. So certainly for our children, it's very important that we get the micronutrients we need to that population. Some additional announcements include on the intranet. If you can go to the intranet, there are two areas I'd like you to look if you haven't already. The first is on open enrollment. At the top on the left, you'll see a banner which allows you to access your open enrollment, and we really need to have this done. It closes on November 10th, Friday. So try not to wait till November 10th to do it. Get to that link as soon as you can. The second is related to EPIC. We're asking as many of the workforce to sign up for their training sessions as soon as possible so that we know that everyone is slated for their appropriate spot within the training sessions. If you go to that intranet page at the bottom under academic links, the very top one is HealthStream login. You click into that and then you go to the To-Do tab and you should see the assignments you have. Some of it will be e-modules, and then there'll be some course registration or training registration that you need to do. And please do that as soon as possible. We're at about, I think 15% are signed up for training sessions, and we'd like to get it as high as we can so that we understand that everyone is enrolled in the right location and getting that training when they need to. Some recognitions within the healthcare space. The following week is Healthcare Facilities and Engineering Week. Respiratory Care Week was this past week. Pastoral Care Week was also this past week. Chaplains were at the B2 concourse for Blessings of the Hand. October is Physical Therapy Month and Audiology Awareness Month. And then lastly, yesterday was World Stroke Day. That's near and dear to my heart as a neurosurgeon who has been involved with stroke awareness and stroke care throughout my career. Stroke is the leading cause of disability in the United States. It's maybe the number 2 cause of mortality worldwide. It carries, as many of you know, time is brain, and so it's a very time-sensitive event. And so recognizing the symptoms of stroke is really important. We have a phrase called FAST, which means face and arm weakness, speech, if your speech has been affected, and then the T stands for time. And that's, you have to record the time of the symptoms beginning, and then it's time to get to the emergency room and get evaluated. In addition to that, Albany Med and the health system has tried very hard to be on the forefront of cutting-edge stroke care. We are a comprehensive stroke center, and we've been that for several years now. We're the only site within this region that provides a procedure called mechanical thrombectomy, and this is a procedure that helps remove the clot from the brain of the most severe types of stroke. And it can be a very life-changing event with a successful procedure. All of the symptoms that the patient was suffering from can reverse, and it's a very time-sensitive procedure. We have software throughout our system that uses artificial intelligence to identify patients who have that problem, and then we actually then reach out to the hospital to bring the patient here as quickly as possible. So if the symptoms begin, get to your nearest primary stroke center, and we'll pull you to the comprehensive stroke center if you're needed. And hopefully you don't need that problem, but awareness is the key to helping our population get better.
All right, I think I have 2 announcements as well. So the first one is the Assistant Nurse Manager Donna Hudner from the Pediatric Float Pool was honored with an Eye Care Award at the October Center Combined Leadership Meeting. Donna has been a part of Albany Med family for more than 40 years. She was nominated by a fellow nurse based on a situation involving a parent of one of our pediatric patients. The mom, who is paraplegic, had been left stranded at the hospital by a personal aide. According to the nomination, during the whole ordeal, Donna treated this mom with nothing but kindness and consideration, all while respecting and preserving her independence. The mom could not have been more gracious and appreciative of Donna's effort in helping coordinate her transportation home. Also quite remarkable. And also we have nominations are open for the Employee of the Year. They are open for the 2023 Employee of the Year award. These employees are invited to nominate a colleague who exceeds expectations in the areas of compassion, accountability, respect, and engagement with parents, families, and colleagues. The nomination form is available on the intranet and messengers. The deadline is Wednesday, November 15th. The last year winner was Emergency Department Nurse Brianna Caban.
Well, thank you. Thank you, Dr. Jadovich. I have the distinct honor of closing the video in Dr. McKenna's words. Take care of yourself, and please take care of each other. Thank you.
Thank you.